Viewers and editors thought that actually people wrote too much. This section was too long, too verbose, and very often it talked not only of the issues that were addressed by the authors, but also issues that the current study had nothing to do with. They found that the sequence did not flow, so when they read it, the text was disjointed, and there was jumping from one idea to a totally different idea, and so on. Some ideas appeared in first paragraph and maybe in the fourth paragraph, but the paragraph 2 and 3 had nothing to do with that idea. Occasionally, some new information appears in a paper for the first time in the discussion section. I know it appears difficult to believe, but it happens. We heard a little while ago, how can something appear for the first time in results without there being methods? But even this happens. Also, sometimes editors found that authors were talking about very trivial points or something that is very obvious. They did not need to discuss that in detail, while at the same time ignoring things that the authors found difficult to explain. What to do in each of these situations, I'm going to refer to that briefly. So, to make it easier to write, it has been suggested that just like we have a structure for the paper, the emirate structure, we can have a structure for the discussion section. So one can start with stating or restating one's major findings in brief. Then one can refer to the strengths of one's study, which could be related to study design, the techniques one used, the type of results one found. Then one discusses the findings, first the major findings in relation to the existing or the prior information. Then one goes on to relatively smaller findings or minor findings, especially those that are important, and then gradually go to even less important findings that one may wish to discuss. While discussing this, one refers to the implications of these findings, which for us in medicine are often related to practice of medicine, and sometimes it throws up new ideas for research. Thereafter, one discusses the limitations of one's studies and finally ends with a summary or a conclusion. So one of my colleagues, Ivan Hutin, who works for WHO, has actually summarized this in the form of 4 questions. And he said that we could look at it as, first we'd say a summary of findings but that's in short, and that does not contain much of quantitative results. So you say what was found, then you make your points, first the most important, then the less important, and maybe sometimes a third or fourth point. So you basically, based on what you found, you try to say what can be said on the subject which you have investigated. Then you come to limitations, that is what one cannot say because the study has certain limitations. And finally, you conclude with what you can make of it despite the limitations. So let's look at each of these subsections one by one. In the first paragraph of the discussion, you try to summarize the results, but this has to be only in big picture terms. This is also a bit like sometimes when you start your seminar or a journal club, you put out an outline about how you would be discussing. So in a way, if you summarize 4 things in the first paragraph from your findings, you are kind of setting the stage that these are the 4 points I'll be discussing, and possibly also saying that this is the order in which I will be going. At this stage, you don't interpret, you do not repeat the results in great detail, you try and be as brief as possible, and do not start discussion right here. That will be reserved for the second paragraph. Now, I will take you from the first paragraph of discussion to the last one, and then we'll come to the middle. In the last paragraph, you summarize your conclusion points, and generally you are clear about them because you have discussed your findings in your own research group. You have possibly presented it at a conference, and therefore you have thought about it. And based on these conclusions, you can even propose some recommendations, especially if it is an epidemiological study. Sometimes even for a lab study, you can do that. So you can say whether it needs future studies, whether it already has implications for patient investigations and treatment, etc. But when you do this, you need to be clear that your recommendations should be based on the conclusions and should not be far removed from these. And at this stage, you do not repeat the results. What you are trying to do is you're providing an interpretation and what should be done about this rather than just summarizing the results. So the middle part now is easy. So the first paragraph was the results, last is the conclusion, and you now need to construct a bridge combining these. And sometimes it helps to think as if you have your findings and you're talking to a friend whom you haven't met for several years, or you're just talking to him on the phone, or you meet him somewhere in the corridor and he says, what have you been doing? And you say, this is what we did and this is what we found. And then from there to conclusions, you are trying to explain to him how what you found means what you think, and that is exactly what goes into the middle part. So this interpretation has to be in the light of your initial study question, initial hypothesis, whatever you thought of when you started the study. In doing this, it's helpful to talk about the strengths of your study. These strengths very often lie in study design. You have very large study, large sample size, the previous studies were small, that's a strength. You have a controlled study, the previous studies did not have controls, that's a strength. You assessed variables which are much more strongly or much more reliably measured, that's a strength. You could have followed subjects for a longer duration, and that's something which is a positive thing to emphasize. Also, sometimes you could use a technique which is new, which is well established, or but has not been used previously in the group that you're looking at. You may have taken steps to make it better standardized. For instance, let's say you were doing a study on recurrence of tuberculosis in a certain group of people. You followed people, but you looked at sputum smear, and now you have PCR. So you do this. Maybe you now have a investigation technique which is based on CRISPR-Cas technology or something that is newer, but it has not been used for tuberculosis, and you're using that. So that could be the strength. So you need to talk about it. The other thing that you do is you compare your results with those of other studies, if there are other studies available on the same topic, which is very often yes. So what you do is when you try to compare, you need to think whether the comparison is in fact valid. If I do a study to look at seroprevalence of COVID-19 antibodies in Puducherry, for instance, I can compare this to a study in other parts of India. But if I try to compare it to studies from France, from Greenland, from Australia, that may not be appropriate. Secondly, if I do study mainly adults, and I can't compare this with studies in children. If I use an assay which is antibody-based assay, I can't compare my results with a test which is based on RT-PCR, for instance. If your study matches, results are very similar or fairly similar to those of previous studies, you build your arguments around consistency. But if your results are indeed different from those of others, then you need to provide possible explanations. I did not say explanation, you talk about possible explanations. What could have caused it, though that may or may not be true. So you talk about the possibilities, the more likely first, then the less likely. But you need to talk about even the less likely explanations. If there is something on which there are studies on both sides, you need to discuss both types of data and both type of views equally well. You cannot do this that if you have already 6 studies available on a subject, 3 are in the direction where you found and 3 are in the opposite direction, that you refer to either only or mostly to studies that had findings similar to yours. You may think that it wouldn't get caught, but the reviewers are generally people working in the same field. They would be aware, and then they would ask you why you haven't discussed those studies. It's easier to talk about it and say that you are aware there is an opposing viewpoint, there are opposing findings, and then state your case. Why do you think your study data are more reliable, rather than not discuss the opposing view. Now, the problem with difficulty in writing is that all this requires that you should have a good grasp of information. Firstly, you should have information. You should understand the nuances well. You should understand mechanisms, pathophysiology well, and that is why it is difficult to write. So very often this will have to be written by the most informed, the most experienced person in the group. And if you are a young person who's not that experienced, do try your hand at it, write it, but don't be upset if your supervisor, if your mentor works on this and changes this section thoroughly, because that is bound to happen because he has a better grasp of information. If you need to criticize the previous studies, please by all means do, but that criticism has to be based on reason, on logical arguments. Don't just say that ours is the best study and others are fools or something like that. You need to be diplomatic, have scientific reason rather than just political statements. Sometimes you have findings that you were not expecting and something very unusual turns up, but you should not ignore that. Say that you found something that you did not expect. Try to provide an explanation if you can think of one or two, but if you cannot, at least state that you have noticed this and you have no explanation, because it would automatically happen. Most of the time what people do is they just remove this finding from their results. That's not true. Sooner or later somebody else would also do similar study and they would find it, and then they would describe it, and then if you go around and say, oh, we had also found this but we did not report this, there is no credit for that. It's much better to bring such findings forward, so that once these come to the fore, there are people who would investigate this when they do similar studies. Finally, you do need to talk about the limitations of your study, and that's one of the most important components of the discussion section. These limitations could be related to selection bias, a small sample size, a weaker study design, and sometimes it would mean that because your patients are highly selected, your results may not be generalizable to other situations. By generalizability, we mean that they may not be applicable to your other situations. For instance, again, taking the example of COVID, if I find 45% seroprevalence in my population in Puducherry, that doesn't mean that it applies to other parts of India. Again, it might apply to some parts of India, but if I go to UK, or for that matter Oman or some other country, it may not be generalizable to those settings. If you have a lot of dropouts, then that could be a limitation. Again, don't push them under the carpet. Talk about your limitations, and what you do is you kind of have a clear-cut, fairly visible limitation section. Some people, so you, after you have summarized your results, you have discussed those, then you talk about the limitations, but this has to be before the conclusion. Some people think we'll talk about it after the conclusions, but no, that's not the place, because your final conclusion has to take into account the limitations and talk about what you can conclude despite the limitations. For each limitation, you need to say what the limitation was, what does that limitation mean in terms of interpretation of your results, did you do something to address this limitation, and how can you still conclude something despite the limitation. And I'll show you an example. Some of you would think that I'm spending too many slides on limitations. Let me again reinforce, the limitation section is a very important section of the discussion, and reviewers and editors are looking at it very carefully. So there could be, let's say I work on infectious disease. Let's say I was investigating an outbreak, and from people who were affected during the outbreak, I tried to culture, I try to do PCR, and I could not find the pathogen. What does it mean? I cannot be certain that the people had that disease. It's possible that they had something else, so another diagnosis is possible. However, there could be reasons why I could still say that it is the disease that I'm thinking of. Some of the reasons I have given, and I'll show you the example in the next slide. And then if you are able to provide sufficient justification, it is possible that even though you could not isolate the pathogen or the pathogen's nucleic acids, you could still say that it is that disease. So this is actually taken from one of our papers. HEV here stands for hepatitis E virus. So we investigated an outbreak and we said we collected specimens from a certain number of patients, let's say 20. We were unable to detect hepatitis E virus RNA in serum or stool from any patient in the outbreak. So that was that we could not. What does it mean? Okay, and then how can we address this limitation? However, 17 of our 19 patients had IgM antibodies against the virus, and these are highly specific for recent infection, and we have provided a reference for that. So what can we do further? Virus in the blood and or in the stool is generally present for 10 to 14 days after the onset of illness. By the time we learned about the outbreak and studied, people had been ill for about 2 weeks, and that is a justification. And you could state still, and now the next sentence could be, so we still think that this outbreak was caused by infection with hepatitis E virus. So in the discussion, just like Piyush said, that in the results there is a certain order. You start from positive findings, then the negative findings, or you go in a chronological order. Here you start with the most important point, then go on to the less important ones, but always remain confined to the subject you studied. If your study is related to treatment of a particular disease, please talk about only the treatment. Don't go into pathophysiology, don't go into investigations, diagnosis. And when you have multiple paragraphs, ensure that there is flow from one paragraph to another. There are linked sentences, and I'm sure you'll hear about this more tomorrow when I think Dr. Lodha is going to talk to you about language and style. So towards the end, you talk about the implications. These could be related to alterations in practice, alterations in public health, public policy. In papers which are related to basic science, this could be a better understanding of the pathogenesis or mechanism of disease. Sometimes your implications may be very geographical. So that's something, in India is different from other parts of the world or in your geographical area. So you need to then talk about geographical implications. If you have developed a cheaper test or a cheaper treatment, implications could be financial. Talk about those. But whatever you do, don't think of the easiest explanation. There can always be alternative explanations, and you should think about all potential explanations and discuss those, if other ones, if they are possible. So speculate. To some extent, you can, extrapolate, but only to a certain extent, and that too intelligently. Remember, every correlation does not mean causation. Just because you find bald people develop heart attack more commonly, it's not baldness that causes heart attack. It is the older age and male gender which cause both baldness and heart disease. Some other things, don't start with history. Don't repeat all your results, only a summary. No new data can appear in the discussion section. Extrapolate only up to a certain degree, and don't use superlatives. Finally, in the end, you need to talk about what does it mean, provide a take-home message which should be supported by data. Once you have written this, ask a colleague to read. Piyush has talked about it. Get feedback from your worst enemy, and then use that feedback to rework on the discussion section, and only then are you done. So let's look at some examples. I've seen, there was this paper that I was reading which said Arnold and Chiari first described so and so in 1942. That's history. That's not relevant to the current paper. Instead, if you say, let's say for another disease, our results indicate an increasing prevalence of such and such disease or seropositivity from 48% 10 years ago to 69% now. This is what we mean by summary of results, and based on this, you can then discuss. Superlative sentences, avoid that. On the other hand, try to start as if you are an underdog, as if your findings may not mean anything. So it is useful to start like, somebody could argue that our data have no major implications. However, we think there is some implication, and build up your arguments one by one and take them to a logical end. Again, instead of using just sweeping statements, argue, provide reason, provide references for those reasons, and that is a better method. I'm now going to use one of my papers, our papers, as an example about how the discussion section is and how it is organized. This is a paper on health economics, cost effectiveness of hepatitis B immunization. You can see it is 2003. It was some 18 years ago when India did not have hepatitis B immunization for all children. It was thought that this was not cost effective for a country such as ours, where income was low, endemicity was relatively low, intermediate, and we did a cost effectiveness analysis. So this is our discussion section. So it starts, and so this is the first paragraph. This has to summarize the results. In our baseline analysis, universal childhood hepatitis B immunization led to 1, 2. In a way, we are saying these are the two major findings, and we are going to talk about these. And then we say, for further, the next finding was these values change little if the rate of vaccine coverage, the efficacy of the vaccine, and wastage was somewhat different from what we had presumed. Then we talk about something else, and this is a third major statement. If we that this model did not include something, but if we include the cost of treating complications of hepatitis B also in the model, then this would actually mean something very different. So these are the three findings. Now, I said that these first paragraph should not be very numeric, but because this is a cost effectiveness paper, so numbers have to come in. But otherwise, this is much less numeric than what the results of the paper are. So we kind of say what are the things that we are going to discuss. Now, we try to discuss these findings, place these in perspective, so to say. So we said here something, okay? And then we say, how do we do this? So we say a country's gross national product represents the amount that a person contributes to national health. Any new treatment or vaccine that increases lifespan so that people have to pay for every extra year below this should be paid by the public exchequer, and this is the accepted principle by the world, and we provide a reference. Our data shows this, and based on this prior knowledge and our finding, we can conclude that this vaccine is suited for inclusion in India's national immunization program. Okay, and then we also try to slightly extrapolate other low-income countries with intermediate hepatitis B endemicity may also have similar things, and so our results might also cover them. Then we say, what is the relevant to the existing knowledge? So we say data are available from rich countries or those where hepatitis B is much more common. But what was not known was data from low-income countries such as India and where hepatitis B is not as common, and those are limited. Then we say there is some data. Somebody had tried to do this for all parts of the world, including something for India. Okay, they published something. So we talk about the other people. However, they did not what their paper lacked was they did not do a detailed sensitivity analysis. We talk about the strengths of our study, a stronger study design, a stronger extension, a Monte Carlo simulation, okay, whatever. And this means that our conclusions are more robust. We are not criticizing them. We are referring to their work. We are giving it due importance and very scientifically saying that they did something, but they stopped short at that, and we have stood on their shoulders and gone one step ahead. Now, I said you talk about opposing viewpoints, and you see an example here. So we have said something, we said it means something, and now we are saying there have been some objections from the healthcare professionals in India that they think that this vaccine should not be used. So we give them a full paragraph. These objections, what are the arguments of the opposite side? A, B, C. We talk about them. They have said that if the hepatitis B disease rate is higher, then it would not work. If the coverage rate of vaccine in India is much lower, so it's not going to be useful. And we cannot give the vaccine at birth. We will start later, so that may not be good. And we then say that we have already taken into account all those, and we have shown that those arguments are not valid. So we are giving importance to the opposing viewpoint and then demolishing it with scientific data. Now we come to the limitation section. So we start off with very clearly stating, as this first paragraph makes it clear, that this is where the limitation section starts. It may not have a separate heading, but it's very clearly visible. And we even list out our limitations. First, our model did not have something, something, something. And I said, you talk about limitation, say what it means, whether it affects, and whether you have done something to mitigate the effect. And we talk about, when we explain it, and we say, in case we had done this, then actually this vaccine would have appeared even more attractive. Then we go to second. So we actually are counting our own shortcomings. Second, I've deleted a paragraph here which showed about the third. And then we go to fourth. And for each of those, we say what the limitation was and how it could have affected the interpretation of our results. Then we don't give further numbers, but we are continuing our limitation section. Okay, and we say something again we have not taken into effect, but if you take that into account, then this would have actually made the vaccine look even more attractive. The sixth limitation, we are looking at immunization only when it is given in early childhood and not when it is given in late childhood, adolescence, or adulthood. And that's fine. We are also not extrapolating our results to the older age group. And finally, after the limitations also, we can still conclude that, okay, vaccination is of cost effective. And finally, this is our conclusion and recommendations. And here we try to again extrapolate somewhat. We say, though our analysis focused on India, the results are, so we're talking about generalizability or applicability, are equally applicable to other low-income countries where hepatitis B is as frequent as in India. And then we make it clear what audience we are trying to, and what action do we want from them. We hope that these data will convince health administrators and policymakers in such countries to introduce universal hepatitis B vaccination at an early date. And it did make an effect, and it did help introduction of hepatitis B vaccination in India. So to summarize, friends, the discussion section we all know is difficult to write. So if you find it difficult, don't be surprised. Don't get disheartened. Try, and after you have finished, very likely that your supervisor or mentor is going to change a lot of things in this section. Break this into sections: a first paragraph, a last paragraph, middle paragraphs focusing on the strengths, discussing your results in relationship with the results of other studies, and then the limitations. Provide link sentences that helps continuity for somebody who's reading. Let each paragraph refer to short, clear, one issue, and at the end provide a take-home message. And with that, I come to the end of my lecture, and if you have any questions, I would be willing to take those.